Hey guys, welcome back. I'm Sylvia, a PhD who loves learning about a multitude of subjects and sharing what I learned. And if you are anything like me, you have someone in your life that split pills. That's right. For me, that's my dear grandma, who is 93 years and 7 months old. And yes, I think that after a certain age, we should celebrate every month of someone's life. That's a trend we should start. Many people around the world split their medications, and that could be for a few different reasons, such as to reduce the costs, to stretch the stash they have, or because the dosage they have to take is not manufactured. And whenever I saw my grandma splitting pills with her bare hands, I always wondered if she was actually taking the right dosage. I could see the little crumbs on her hands. Do you even know if the active compound is uniformly distributed within the pill? And what about contamination or the chemical decay with the other half that she didn't take? Also, think about this. Many pills come coated with special substances that help the pill to not be degraded too early. And so they have to withstand the acidic environment in our stomach. And so if you split the pill, the contents are gonna be exposed to the acidic environment of the stomach. Not to mention that maybe you could experience side effects such as nausea because the contents could be irritating to your stomach. And so with all of that in mind, and my grandma, I wanted to know what science knows about pill splitting. A systematic review published in 2022 looked at 138 articles in this subject. One of these articles in particular assessed 11 different cardiovascular medications that had been quartered. So they were split in half and in half again. Then they stored the pieces in sealed containers away from light for 30 to 45 days and examined the chemical stability of the active component in each pill. Out of the 11, 3 had decreased levels of the active component: digoxin, spironolactone, amlodipine, generic and brand name. And out of those, the difference seen in digoxin, which is one of the oldest medications used for cardiovascular diseases, might have clinically important results. So these results might seem pretty good. I mean, 3 out of 11 and only 1 might be clinically important. But the thing is, the review failed to mention that this paper was focused on veterinary use. So they looked into cats and small breeds of dogs. And although veterinary medication is used in humans and vice versa, I would feel a lot more comfortable if those results had come from a standpoint of human health instead. The review also mentions other articles that deals with different medications such as aspirin, levothyroxine, which is used for hypothyroidism, gabapentin, an anticonvulsant, risperidone for high blood pressure, which were apparently stable for 8 to 10 weeks. But again, there is a catch. All of those split medications were tested after being put in sealed containers at 25 degrees and 60% humidity, which is pretty much impossible to ensure that that happens in your house, especially if they live in places such as I do in the tropics, where humidity and heat are a lot higher than 25 degrees and 60%. Regarding weight or dose variability, 93 different articles were mentioned in this review. Statins, used for cholesterol lowering, warfarin, which is a blood thinner, salbutamol, an asthma medication, risperidone, an antipsychotic medication, Paxil and Zoloft, which are antidepressives, and lorazepam for anxiety, fell within the United States Pharmacopoeia specification criteria for drug content in split pills. But again, there is a catch. All of those were tested after being split by tablet splitters or pill cutters, which, according to another different 29 articles, found out that when you split the pills with a pill cutter, the halves tend to be cut in a more reliable and accurate manner, and so weight or dose variability is negligible. Another study with nebivolol, which is used for high blood pressure and heart failure, compared hand splitting versus knife splitting versus a pill cutter, found out that although the tablet splitter passed the European Pharmacopoeia specification criteria, none of these methods passed the FDA requirement for loss of mass, which prompted them to conclude that splitting pills may result in inaccurate dosing and significant drug fluctuations. And as you can see, the European Pharmacopoeia requirements may differ from the United States Pharmacopoeia requirements, which differ again from the FDA requirements. It's all very confusing. And the second caveat here is that the fact that these drugs might have the same dosage in both halves does not necessarily mean that the efficacy is maintained once you take them. And what about the sustained release medications, which are characterized by the slow release of the active component at a programmed rate to deliver the drug for a prolonged period of time? This type of technology is used for drugs that are metabolized too quickly and are eliminated from our bodies shortly after administration. This technology is achieved by sustained release external coatings, as I was mentioning before, or by embedding the medication in a slowly degrading matrix. So splitting such medications could compromise the release mechanism and result in overly rapid drug release and potential harm from overdose. 27 different articles looked at those drugs and the results vary greatly. While some sustained release medications can be safely split, the impracticality of patients trying to remember which drugs can or cannot be split might become a problem. So my recommendation here is to never split any pills, but if you have to, then my suggestion would be to buy a pill cutter because they seem to be more reliable, and asking your pharmacist or your GP to train you or your caretaker on how to effectively use the pill cutter, and also to cut only one pill at a time and to put away the other half in a sealed container away from light and heat, which, by the way, you should always do to all your medications. Keep them away from light and heat sources. And of course, before getting to any trouble here, I am but a PhD, I am not a physician. So please follow the advice of your GP, specialist, or any other experts that you guys might see. That's it for now. Share this video with people that you know split pills so they can start thinking about the repercussions of their actions. I'll catch you later. Bye.